It's health care reform, $871 billion over 10 years. The Congressional Budget Office says it'll shave $130 billion off the federal deficit. 31 million Americans who don't have health insurance would be covered. Insurance companies would no longer be able to drop people based on pre-existing conditions or deny coverage when people get sick. There's still some work to do, though, and that is it's got to be reconciled with the version that passed the House last month. But again, a major step forward for Democrats today. This is a piece of legislation that could define President Obama's legacy, and it could, if the Senate and the House are able to successfully merge their legislation and get it passed to each chamber again, it would usher in an era of near universal coverage for health care, the first time that has ever happened in U.S. history. We're pleased to be joined by Democratic strategist Keith Boykin and Republican strategist Danny Vargas. And Keith, first, your reaction.
Well, I think this is a historic vote, as you said, and it represents the triumph of courage over cynicism. You know, there are a lot of objections the Republicans raised. They said they didn't want a public option, so they got rid of that. They didn't want a Medicare buy-in, so they got rid of that. They didn't want illegal immigrants covered, or undocumented immigrants, so they got rid of that. They didn't want abortion coverage, so they got rid of that. They didn't want to add to the deficit, so the Congressional Budget Office scored it and said that it actually reduces the deficit. And yet still, not a single Republican voted for it. I mean, what did these people really want? What they wanted was to block health care reform for the American public.
Danny?
No, absolutely not. I think, something this monumental, something this vital, 1/6 of the American economy. What's a shame is that this really should have been so much of a bipartisan effort. We should have been able to get to a point where we avoided seeing Washington at its worst, frankly, with the backroom deals and the negotiations late at night and buying people off with billions of dollars of payoffs to get their votes. We should have been able to get to a point where we could have avoided this huge amount of tax increases at a time where the last thing we need right now is tax increases.
So Danny, to be absolutely fair, I mean, Senator Max Baucus of the Senate Finance Committee delayed action for months to keep the discussions going between those three Republicans and the three members of three Democrats in his committee. I mean, to suggest that this was somehow not bipartisan, I mean, that really doesn't square with the facts. Most of the summer, that's exactly what Senator Baucus was trying to do. Republicans were part of this, but then their leadership essentially put enormous pressure on Senator Grassley and the others not to be part of it.
But some of the main ideas to actually move towards market-based reforms. We do need reform of the healthcare system in this country, but to be able to do it in such a way that you don't have a government takeover of the system, where you've got competition across state lines, where you've got small businesses pooling together, where you've got malpractice reform, and those types of things were never included in any of this reform packages. We now have a 2,700-page bill that nobody's read, that nobody really understands what the unintended consequences are going to be.
David, these are just talking points that Danny is raising. I mean, the Republicans have no good objection left because all the objections have been erased. President Obama and the Democrats in Congress bent over backwards to accommodate every single Republican objection, and yet they still don't support this bill. The Republicans never wanted health care reform. Let's be honest about this. As someone who has lived without health insurance in the past because I'm a self-employed person, I know how important this is for the 31 million Americans who will be covered by this. For the Republicans to use cynicism, just blatant political cynicism at a time when the American people are suffering, it's just unconscionable, and I think the Republican Party will suffer because of this.
No, look, the Republican Party wanted health care reform. We still want health care reform. We still want to be able to work towards getting those provisions in there that we think are important. There are some good provisions in this bill. I think there's some things that we could definitely support. My concern is the fact that the costs are going to go through the roof. Right now, we're talking about $871 billion in the first 10 years, but the taxes kick in now. The Medicare cuts kick in after the 2010 election. The subsidies don't kick in until 2014. So in the 10 years when the system is actually up and running, in that first 10 years when it's actually up and running, the costs are going to be $2.4 trillion. So the costs are going to go through the roof.
Keith, I'll give you the last word.
Okay, two quick things. First, the Congressional Budget Office actually scored this and said it will not add to the deficit. It would actually decrease the deficit. Secondly, the Republicans had 8 years when they controlled the White House. They didn't do anything about health care reform. George Bush passed a prescription drug bill, which actually added $500 billion to the federal debt, and they didn't pay for it. None of the Republicans were concerned about the debt then. They weren't concerned about it when they passed the 2 tax cuts. They weren't concerned about it when they paid for didn't pay for the 2 wars that they started. Now, suddenly, that they're trying to help the American people, they want to care about the deficit.
Democratic strategist Keith Boykin, Republican strategist Danny Vargas, thank you both. We appreciate you hanging in there. We're going to take another break.